Okay,
Okay.
well, let's go ahead and get started. Hi, everyone. My name is Angela Smart. I'm the Chief Development Officer for Swope Health. I'm going to take about 5 minutes to kick this off, and then I will hand it over to Chris Davis, who is on the call representing PGAV Architects.
Mhm.
Welcome to our virtual workshop on our RFQ, request for qualifications for our Kansas City, Kansas Women's and Children's Center. So I thought I might just take a minute to talk about Swope Health and to talk about this new building that we would like to feature original artwork and graphics in. So we are in process of building a new $55 million building in downtown Kansas City, Kansas. It's at the intersection of 7th and State Avenue. It is a partnership project between the Kansas City, Kansas Community College. They'll have most of the first 3 floors of this building, Swope Health, which will have the entire 4th floor, and then Community America Credit Union, which will have a branch location on the main floor. And they'll also have a drive-up area. This will represent the third building in, not the third building, but the third campus, I should say, in the Kansas City, Kansas family of campuses. And we're excited to, both the college and Swope Health are excited to be really moving into kind of the core of downtown Kansas City, Kansas, which is this project really represents a wonderful kind of revitalization of what was a blighted block. The former buildings on the block have already been torn down. The Willa Gill Center, a really important community services agency, remains on that block. So just a quick elevator speech about Swope Health. So we are a community health center. The technical term for Swope Health is a federally qualified health center. What that means is that we do receive some federal funding, but we really are serving patients who vast majority have Medicare or Medicaid. So we're serving people of all ages. The KCK location will be specifically a women's and children's center. So it will have women's health services, OBGYN, prenatal care. We'll have a lot of interesting wraparound services, a WIC office. We'll also have a full pediatric clinic. We'll have a small behavioral health clinic for mental health care. And we'll also have a full dental practice. So even though we say Women's and Children's Center, this building will be open to all. And the dental practice, for example, will see full families. And to clarify, it's also not just a clinic for the college campus. This is a clinic that will be open to the public. Swope Health already operates 2 busy clinics in Wyandotte County, Kansas. So we're familiar with the people that we're serving. We know that we will serve a lot of patients who are primarily bilingual Spanish speakers, people. The majority of our patients live at very low income levels. And with all that in mind, as we were thinking about our concept and our dream really for this building, we wanted to make something that was very special for our patients, something that was a unique, one of a kind. We've talked about it being a national model for community health. There's a lot of synergy to having the women's and children's services co-located. And we wanted this piece, the kind of the interior design using the concept of a partnership with the Kansas City Zoo to be really kind of a story that we could tell, something kind of that we're creating some original art and really adding to the beauty and the stature of that building through bringing in some original art, original design concepts. So I'm going to share my screen and just kind of pivot over to the written RFQ. This is all on our swopehealth.org website. And we're not going to go through all of this. I'm going to hit the high points, and feel free at any time to be putting questions in the chat, and we'll also have time at the end for Q&A. But what we're kind of putting out there is the desire for a graphic design and art curation person. We are seeking, we did want to put this in writing, seeking an up and coming diverse graphic designer and art curator to use inspiration from the zoo to create original graphics. We will work all very closely together and with our architecture firm, PGAV, and the construction managers, McCown Gordon. I won't get into all of this, Chris. I know you're going to hit on a lot of it, but I did want to jump down to the timeline. We are asking that people respond to the RFQ by March 14th. We're going to create a Q&A document after this meeting, and we'll get that published also out on our website, just so everybody can see any additional information that's shared. But then we'll kind of move into an internal review process. We will have a review committee that represents not just Swope Health, but the college and PGAV and others from the patient community. We really want to get multiple eyes and multiple opinions to the table as we're looking at this. We will likely conduct some virtual interviews of the top candidates, and then we hope to notify people that will proceed to that finalist stage in April, by April 11th. To apply, we've tried to keep this simple. Hopefully this will be simple. We've asked that you just email info@swopehealth.org this information below. Just copy and paste this into an email and provide all of this information that we're asking for, including a couple of attachments. We'd like to see your resume or CV and at least 3 examples of your work that would align with the project and demonstrate project fit. So I'm going to stop sharing. Let me pause there. If anybody has any questions, feel free to raise your hand or drop them in the chat. Go ahead.
Okay, so you said that you guys required the resume or examples of previous work. So I was just wondering, I have like more examples of previous work that we've done, like murals up at Xavier University, but I don't really have a resume per se, since I'm just kind of a student. But would that be okay if I just included like an art portfolio of all of my previous undertakings?
Yes, sir. I think that would be great. This is, while we're attempting to have some good structure to this, I was laughing today with some colleagues that, Swope Health, we're out there delivering healthcare. We're not conducting graphic design RFQs. So we really want to, keep it casual. If we don't feel like we have what we need for a complete submission, we'll just come back to you and maybe ask for additional information. But that's why we're not doing this like as a formal application where you're required to submit certain things.
Okay.
Well, Chris, I'll go ahead and hand it over to you.
Okay, great. Thanks, Angela. And I might just refer back to that schedule really briefly. There might have been, I think on that schedule list, September 1st is sort of the delivery date for the final artwork. I think there was some discussion about perhaps maybe backing that up to July 1st or something in that time frame. I just wanted to sort of highlight that, and I think, Angela, what we would, or what Swope would do is if there's a change to that September 1st date, there'd be an addendum issued to the RFQ just so everyone's aware of that. Am I getting that right, Angela?
Yes, yeah. And that's kind of driven by the dates that we have to back off to get the things produced to actually be installed. The building will be completed by end of the first quarter of next year, 2026.
Mhm. And our construction manager is in the process of procuring interior finished materials, and one of the things we want to do is give the designer an opportunity to sort of work collaboratively with the architectural team, and if there's any changes that might happen to the finishes, we want to make sure that the construction manager has time to have all that accounted for. So that's one of the things that's driving the schedule. So okay, what I might do is share my screen. We have just a really brief PowerPoint presentation that is going to, let me bring that over here, just sort of maybe give you a little bit of insight into the project, just the physical nature of the project. Is everybody seeing that okay?
Yes.
Oh, I've got
Chris,
the wrong screen.
yeah,
sorry
seeing
about
just your folder.
that. Sorry about that. Let me try that one more time. Let's try. There we go. How about that?
Looks great.
Okay, fantastic. Okay, so this is a rendered view of the lobby in the Women's and Children's Center. Up on the 4th floor, you can see out to the east, you know, you've got a nice view over downtown. So often in children's clinics, you can see a themed environment, right? And it's trying to help patients feel comfortable, right? So for any of us going to the doctor, sometimes there's some anxiety, it can be a stressful situation. So the environment's trying to just put people at ease. And we talked about with this being both a women and children's clinic, how could we sort of theme the environment in a way that would speak to both of those populations? And there was an idea about a partnership with Kansas City Zoo. The zoo has a wonderful mission of conservation and education, and we thought that sort of tie-in would speak well to both areas of the clinic, and would also, rather than just sort of carrying that theme in a generic way, would also sort of promote another local institution here in town that's a great source of education for families. And so it seemed like there was a lot of synergy between Swope and the zoo. And so this is looking at the children's side of the waiting room, and the idea is to have kind of a large graphic on the wall that would sort of represent the zoo map, Kansas City Zoo map. And there was talk about, one idea is that could be sort of a seek and find graphic for kids, and that we've designed a sort of an inset to that wall that represents the zoo train that kids can crawl into and read, and be a nice dedicated space for them. So I guess I should back up to say that sort of the task before the graphic designer is to sort of bring ideas. What we're showing here are placeholders, and we don't want to stifle any creativity. I think the parameters are that the theming within the clinic would just be in alignment with sort of the zoo's mission and an animal-based sort of theme. So so this is just a floor plan of the clinic, and so if folks can see my mouse, this is that waiting area that we were seeing, sort of the top center of the screen. This would be that wall with the zoo graphic and that sort of inset with the train for kiddos. The elevator lobby is here, so you would come up to the 4th floor and enter into the check-in reception, wait for your appointment, and then the children's clinic and the dentistry is on the south side of the plan, which is to the right. And what this diagram is showing is just some accent paint walls that we've sort of planned within the clinic. There's facilities for doctors, nurses, and staff with a break room, various things. And then the women's clinic is on the north side or the left side of the screen. There is a community room that's accessible off the waiting space that's going to host just a variety of activities and meetings. And then there's a behavioral health clinic for counseling, sort of here in this area with the WIC. And Angela, I always forget what that acronym stands for.
Women, infants, and children.
Women's, infants, and children. So this will be some special program centered around that WIC program. So as we look at the clinic, we have identified what we think are the opportunities for graphics and artwork. And I should back up one step. So if you've read the RFQ, you'll notice that there's sort of two distinct scopes of work being requested. The two sides of the clinic want to have sort of a distinct feel, with sort of a very mature approach on the women's clinic, and still a very sophisticated approach on the children's side. We want to avoid anything that's really cartoonish or overly childish, because kids have a very sophisticated sort of sense of the world, sort of, I think, more than we give them credit for. So we'll talk more about that in a moment. But the thought is that the theming would be done primarily through artwork, framed artwork on the women's side. That's why you're seeing sort of these small yellow dashes. And so a portion of the scope is for art curation, to which can be a big task in and of itself, identifying work from individual artists, galleries, sources that could be purchased directly by Swope. I think we would be looking for the art curator to also sort of facilitate review by Swope of different framing and matting options. And then Swope would likely contract with a frame shop directly to have the works framed and final matting done. But we'd like the curator to sort of help facilitate that and bring options to Swope Health for their consideration and review and final selection. On the graphic design side, it would be developing artwork, which could be graphic design, photographic representation that again sort of is in line with the zoo's mission of education and conservation with an animal theme, and these can take the form of sort of super graphics on the walls, but this is sort of a initial representation of the extent that we think that could take. So this is a look, sort of back at that view within the waiting room. This is a view from the women's clinic waiting side of the room. So there's a banquette and just a frosted acrylic screen that provides some separation with some amount of visible view across. This is a sort of a grass themed acrylic panel that would go on top of that banquette, just trying to stay in line with a sort of the natural theme. In the community room, we've are showing just a very sort of subtle reference to honeybees. Honeybees have this amazingly sophisticated social structure, and for a community room, we sort of like the idea of just sort of softly referencing the honeycomb and honeybees for the activity that'll happen in that room with just a frosted treatment to the glass wall. And then there's a wall covering on the back side of the room that would have sort of that golden honeycomb reference. So that hopefully starts to paint a picture that we're not trying to be always super in your face about the theming. And then we've put together, these are just I don't even want to call them concepts, but we want to leave this open to the graphic designer for your artistic creativity, but the idea of sort of animal tracks or footprints is a potential idea. This is the half wall screens at the dentistry clinic, and we thought one idea is just representing with sort of animal patterns and nice photographic imagery of interesting teeth, you know, around the animal kingdom. Could be kind of fun for kiddos. And then in the exam room portion, and please don't take this graphic, we just found something online and kind of put it on the wall more to show extents. But you know, some kind of theming just to represent the animal kingdom and all its diversity and interest. One thought was if there's a zoo map in the lobby, perhaps certain exhibits at the zoo could be highlighted, and each of the exam rooms could be themed as, you know, this room is the meerkat exhibit or the polar bear exhibit or the lion exhibit. So these are all just starters, you know, thought starters of ideas. So we want the graphic designer to sort of bring, you know, new and fresh ideas to Swope for their consideration. There's in the children's clinic, there's a weigh station and a height measurement, and we thought it might be fun to sort of, you know, bring the animal kingdom in and talk about, you know, how tall is a giraffe, or, you know, how heavy is an elephant. One of the things that the zoo does is they provide interpretive graphics at their exhibits, and there's a lot of information and education. And so if there's opportunities to, you know, just convey some of that in the project, I think that would be interesting to explore. So again, these are just thought starters of ideas. On the women's clinic side, you know, again, just sort of nicely curated, framed artwork in a more mature, you know, environment that differentiates itself from the children's clinic is the thought. And then the final slides here, these are the finish selections that have been reviewed and approved by Swope to date. And we would want to, before any of these are purchased, kind of review the graphic design, their art curation, and the finished selections together, you know, some final times to make sure that everything is coordinated and going well together. So that's the end of this presentation. Are there any questions on sort of the nature of the scopes of work and the nature of the graphic design being requested?
I had a question. So it looks like there are 5 walls in total that need that would be graphic designed.
Yeah, let me bring that back up. So if we go back to that diagram, so there's the large wall in the lobby. That's a really important graphic. This is the graphic by the scales and the height measurement station.
Chris, can you share your screen again?
Oh, I'm sorry, I'm not
That's okay.
sharing that, am I? Let me make sure I do that. Okay, is everybody seeing that okay?
Yes.
Okay, thanks, Angela. So yeah, this would be a really important graphic in the waiting room. This one here is the sort of the weigh station and measurement station with the height chart. And then this is sort of the core of the clinic, you know, circulation corridor that we feel like both sides of that corridor, there are some opportunities. This would be the corridor with the exam rooms, the 6 exam rooms. So I think the sort of the theming concept would want to be well developed about, you know, how that how those graphics play into the exam rooms. We've shown a bit of theming, perhaps, inside those exam rooms. And we want to be cognizant of the patient table that would sit right here, maybe not putting a graphic wallpaper right next to where kids, sit, and as they wait for the doc, sort of just pick at the paper. So I think there'll be some kind of technical conversations with Swope about just issues like that. So if I counted 1, 2, 3, 4, 5, and then with graphic design in each of these exam rooms, hopefully that sort of gives some sense of the expectation. And then outside of each dental clinic, I think there's an opportunity. We'd like just as with the exam rooms, we'd like each of the dental exam rooms to have its own sort of identity, and whether that's an identity per an animal or some other way. I think they're trying to each, if you're getting your teeth cleaned in the crocodile exam room, or for each room to be unique. Did that answer your question?
Yes, thank you.
And Angela, if we could consider maybe publishing, this diagram, or for everybody
That's a
to
great idea, Chris.
sort of
Maybe
re-review.
Yeah, publish that deck that you shared.
Okay. Any other questions? We think it's a really, really wonderful opportunity, and that that will just make a big impact for kids and families, and really create a nice environment as people go visit their doc and get their health care taken care of.
I do have one more question. So once what does the approval process look like on your side, once the concepts are presented from the graphic designer, and how many different levels of people do you feel like will be weighing in and approve the graphics?
Angela, do you want to?
Yeah,
that one?
I'll take a stab at kind of what we've been thinking. What we've been thinking here. So it would be a small group of reviewers that would include Chris. It would include myself, Jaron Rabin, the president and CEO of Swope Health. He is kind of an art aficionado and has a great eye, and it should talk about excitement for this clinic. He's over the moon excited for this. We would include Debbie Meads, who is on this call. She is our Swope Health project manager. We'd also include a representative from KCK Community College. We've worked very closely with them on this building, and we do want them to have a voice also. And then in addition, we'd like to call on either some clinic associates who are also patients, or patients. Sometimes we're able to just engage directly with patients and make sure that they have a voice in the selection process also. We've kind of, we've been giving some thought to how we do our evaluation. We've not I'll be completely transparent, we have not created any type of scoring matrix at this point. We do know that some of the things that we'll be looking at really are creativity, some technical skills, understanding of the project. We aren't going to lean in as much to experience, because we are asking for somebody who's up and coming and maybe a student, may not have a lot of experience in paid graphic design quite yet. So one thing that I'll address also is kind of the payment for services. Swope Health does plan to pay professional rates for services. We didn't put anything into the RFQ itself on specific numbers, just because we feel like this is something that we would individually want to work with you to discuss, negotiate. Again, because we're not in the business of making these acquisitions very frequently, we're going to need to kind of come up to speed ourselves and educate ourselves um, on what rates should be. But all that to say, this is in no way something where Swope Health is trying to get a great deal. We're going to be definitely compensating and excited to do that and make that investment.
Question.
Yes.
Okay, so like far as artistic expression, I'm just kind of wondering like where you guys might be leaning towards far as how realistic. I know we don't want to undermine the intelligence of the children who will be attending here at Swope Health. So is it just like a digital design we're looking for, watercolor design, a graphite, or are you open to just all forms of artistic expression? And also, far as if we're trying to keep it as realistic looking as possible, artistic expression in the aspect of maybe taking the initiative of maybe making the smiles more humanistic. Maybe we'll have the animal looking very realistic, but then we'll put a human touch to the smiles or something just to make it a little goofy. Or do we want to kind of keep it very more mature level? What do you think?
I'm going to let Chris give you the technical answer to that, but I kind of love all the things that you just said. It's
Yeah.
kind of all of the above. We
I-
for sure we would be interested in any form of media that you would use, like you said, whether it's watercolors or charcoal or I think anything goes as far as that. We've talked a little bit about photography. I think some of Chris's drawings showed photography, but Chris, why don't you jump in also on that one?
Yeah, I always, my approach to this would be to not stifle anyone's creativity, right? I agree that I think sort of the sky's the limit in terms of we don't want to put it in a box, right? I think just in the parameters that it's in line with recognizing the brand of the Kansas City Zoo, bringing that to another location in the community, being in line with what they do, which is teaching people about animals, sort of celebrating the animal kingdom in all of its, curious, manifestations and things that are, whenever you watch the Nature Channel, all these cool things that you learn, right? And they again, the zoo does a really good job of providing interpretive information, and I guess that's a question whether that's an opportunity. It's not a parameter, but I would say don't limit. We don't want to limit that. I agree. It could be digital art. It could be pencil, graphite, watercolor, photographic work, and I just think it wants to be what the feedback that we've heard from Swope. So I'll try to maybe kind of capture it. Is it just those I almost hesitated to put some of those examples up on the screen because we did not start to produce any representation or artwork. We just kind of grabbed some images off, the internet, and so they do those feel more cartooned and maybe dumbed down for kids. So I think it wants to feel sophisticated, and I like your words. It wants to sort of respect the intelligence of the kids and folks in the clinic in a way that's fun and just celebrates what's really interesting about the animal kingdom. So Angela, one thing it might be interesting. So the portfolios, I think, will tell a lot, right? You'll get a sense of designers' work, and it might be interesting to have the proposers just submit like an artist statement. How would they interpret the opportunities of this project, and that might sort of be revealing and start to help some alignment, between the expectations of the clients and just the approach of the individual artists.
Yeah, we did actually ask in the response for a 500-word max approach to this project.
Great. Yeah,
So
that's a
hopefully
great
that could be
opportunity.
captured there. Yeah.
Mhm.
Awesome. Thank you. That clarifies it a lot.
Good. It's a great question.
Any other questions? Okay, well, we really, really appreciate you joining us this afternoon, and thank you for your interest in this project. Please, I hope that all of you will be submitting and or sharing this with your colleagues and friends and other students who might be interested in submitting. Again, we're hoping to get a Q&A document produced and posted. We will be very responsive to any questions that come in to that info@swopehealth.org email address. So feel free to reach out to us that way. And with that, Chris, thank you very much for your preparation and help with this. We're all incredibly excited about this project and look forward to creating an amazing place for our patients.